Hello, my name is Isaiah Griego, and my proposal is on discouraging the use of punitive action for healthcare errors here at UNMH. A quick little introduction will be the healthcare industry is universally accepted as one of the most stressful industries for an individual to work in, and that makes sense because we are dealing with other people's lives. In the setting of COVID-19 and this horrible pandemic we're living in, this has been the perfect storm of increased workload and hypervigilance surrounding the healthcare system, and has led to increased rates of punitive action against healthcare employees that make mistakes in the facilitation of patient care. The goal of this presentation is to discourage the use of punitive action against healthcare professionals and instead replace punitive systems with ones that promote transparency. So how this affects healthcare. There's been a marked decrease in patient value inventory scales of healthcare resources over the recent years. Patients are becoming less satisfied with the care they are receiving in healthcare institutions around the nation, and in New Mexico, especially here at UNMH, we are not immune to the effects. We are serving an underserved population, and we're the only level 1 healthcare facility for them to turn to for their needs. So, those effects are exacerbated. There's been a marked increase in burnout reported by healthcare professionals. More professionals are leaving the profession because they have no incentive to stay when their efforts are not being acknowledged and only their mistakes are being punished. There's an increase in the amount of healthcare errors reported throughout the nation since 2018. This has been from the patient's perspective. There's been an increase because of low amount of resources and low amount of staff and them having to make horrible decisions in the clinical setting. Also, there's been a marked decrease in mistakes being self-reported by the healthcare workers. This has led to less favorable patient outcomes overall because they're the ones suffering the repercussions of healthcare professional mistakes. So the current situation. Healthcare systems are faced with an interesting and pivotal movement at the moment. Healthcare systems are stressed by the increase in demand for healthcare resources in relation to the actual resources available, and healthcare workers are put in high-stress environments without the appropriate resources and with increased demand for their talents, which is a breeding ground for mistakes and has led to additional stress that compounds on itself. An example of this is the trial of Redon Devat. If you have not heard about it, Redon Devat was a nurse charged with 2 charges including reckless endangerment and negligent homicide after making a mistake that led to the death of a patient. She reported herself to the regulating body within the institution. This was covered up by said institution, and it was brought to court by the patient's family. This institution then retaliated against her, and this led to less reporting of mistakes at that hospital and decreased patient satisfaction rates, and they lost their level 1 trauma certification and their federal funding that came along with that. Prosecution like VOTS loom large for our profession, and our healthcare professionals are terrified of being criminalized for such mistakes. That is why we need to avoid a punitive system. My proposal is to avoid using punitive retaliation against healthcare professionals for their human errors. For the implementation, I will be suggesting that we add a reporting system for errors that would replace our punitive system. This is where professionals can submit anonymously about themselves and others for seen or suspected mistakes. This will lead to transparency and a culture of learning and kind of reduce that negative stigma surrounding errors. It will differentiate and uncover issues that are happening on an individual level and a systems level and allow us to act accordingly. For the assessment of the implementation, we will be looking at patient satisfaction inventories, professional satisfaction inventories, corrections of the issues, process improvement projects, and the amount of errors both documented and reported. We'll see an initial rise in the amount of errors, and that's to be expected because our professionals will be reporting the human errors that they have or that they witness in the clinical setting. But we will see decrease in specific areas once we enact plans to deal with the prevalence of these errors. And that's how we will measure the effectiveness of this proposal. So my qualifications overall are I've worked in a teaching hospital that allowed me to witness issues that were happening amongst many individuals in a patient care setting. And I was able to also see that these were fixed on a systems level. Human error is not going to go away anytime soon, but if we enact systems or replace old systems that promote the prevalence of human error reaching our clients, we will be better off in the future. This has also been proven to be the most effective method at process improvement and patient safety by recent scientific literature, specifically a meta-analysis that was very comprehensive and used hospital data from around the world that was published in 2022. So the costs of this proposal are overall going to be about $500,000. Before you gasp at that information, I would like to point out that on average UNMH spends about $135 million a year in uncompensated medical care, and 80% of that cost is due to medical error. So to go over a quick cost breakdown, 11% is going to be focused on software purchase. This is about $50,000, which will be allotted to purchasing the necessary software for the facilitation of this reporting system. Installation and integration will take about $20,000, and this is just to ensure that it will be done in a reliable and timely manner. After this, there will be 2% allotted for a clinical educator and the construction of an online education program. And then also its reliable integration into the UNMH healthcare system. $10,000 will be allotted to that clinical instructor. The highest cost you see here, which is 56% of the proposal rollout, is geared towards the employee compensation for the training. They will be entitled to 1 hour of compensation at their hourly salary or hourly rate. And this will be used, this is kind of a generous estimate because only about 38% actually report the time for the training into the hard copy system. And this just makes sure that all 7,000 employees at UNMH, which take part in direct patient care, have this training, which will be mandatory. The remaining data entry specialist cost, which is 27% of the cost, will be about $135,000, which will be allotted yearly. This is going to be a recurring expense. These are for the data entry specialists because they will be the ones that are scouring through the information and organizing it in a way where we can make actionable decisions. So the overall benefits for this are going to be better patient satisfaction with care, better patient outcomes following errors because we can act to them accordingly and timely, and better identification of preventable errors. Downstream effects will be increased staff retention because they will be working in a more positive and safe environment, and higher job satisfaction among staff. Also, there will be a culture of safety and learning that is promoted amongst our employees here at UNMH. And on top of this, with better patient satisfaction with care, implementation of evidence-based practice, we will be receiving more federal and state funding for our services. In essence, this proposal actually pays for itself within about 3 years. These are the references I've used for my evidence-based rollout. Feel free to contact me if you have any questions. Thank you very much. Bye-bye.